morning, everybody. I'm Dr. Becky Thompson. I'm in my day job. I'm the Director of Clinical Services with the Wisconsin Early Autism Project. I'm a clinical psychologist and board certified behavior analyst. And I'm here really today in my volunteer role with the Wisconsin Autism Providers Association. And I'm currently serving as the president of that organization. So here to share with you some of the advocacy that WAPA has been doing, and which I'm very passionate about and enjoy very much. And in particular, in the times that we're in right now, when there is a lot of divisiveness within politics and what we see on the news, access to autism services is something that really everyone can get behind and is a bipartisan issue, which is, I find, very refreshing, and hopefully you will as well. So who is the Wisconsin Autism Providers Association? So we're a trade organization of treatment providers. So companies are members of WAPA, which is a little different from, you might hear WISABA, the Wisconsin Association for Behavior Analysts is for individual clinicians. So like I, as an individual behavior analyst, am a member of WISABA, which represents those clinicians. WAPA represents kind of the companies and treatment provider organizations. But we work together and partner. We consider ourselves sister organizations. But just so in case you hear those two different terms, you kind of know who's who. So WAPA was formed back in 2017, around the time that, that Forward Health and Medicaid started covering treatment for autism. And really the reason that we got formed, got organized more formally was because of significant wait lists that we were seeing and difficulties that families are running into accessing services. And the different providers actually got together informally for years prior to the Medicaid benefit coming out. DHS has always been very collaborative, which we're really appreciative of. And we had regular meetings with them helping form that benefit. Once that was rolled out in 2016, we had ongoing meetings to discuss what was working well and what were some of the pain points within that benefit. And at that point, actually, they recommended that we get a little bit more formally organized, and that was the beginning of WAPA. And so we're made up of 10 different organizations. You can see on the right is all the counties in which we offer services among those organizations. And we currently serve over 2,000 clients and employ over 2,500 staff members. From our best estimates of surveys that we've conducted of all the children with autism accessing ABA in Wisconsin, we're treating about nearly 65%. So the majority of kids who are accessing treatment, it is through a WAPA provider. And then where I think really shows where our values are and where our passion is that we also, even though it's 65% of the entire population of kids getting treatment, we're 75% of the kids who have Medicaid funding that are getting treatment. So we're very motivated by equity and access to treatment. That's a priority for us. And so something important to know about the values of organizations that belong to WAPA. So a quick shout out to who those organizations are. So these are all of our members. And so just for level setting, I wasn't sure what the background of the team, but I imagine folks are familiar with ABA, but just a little bit of basic information there. Lots of alphabet soup. So applied behavior analysis is a field of study that seeks to understand and improve the way people learn. And really a foundation belief and principle of our field is that all behavior happens for a reason. So things don't happen out of the blue or because of some inherent quality in that person. It's all related to the environment and the contingencies that are set up in someone's learning history. And I think the beauty in that is that means we can change any behavior to try and help improve the life of that individual and the community. And so by figuring out for any given behavior that we want to see more of or less of, what's influencing that behavior, how can we change the environment and the circumstances to make something more likely or less likely to occur. We develop individualized goals. We frequently measure progress to be sure that our treatment is effective and that it's maximally effective and efficient. So if we're not getting to that goal as quickly as we should be, trying to make adjustments so that our treatment is always effective and really producing meaningful outcomes for our clients. We really try and meet our clients where they are, what specifically their needs are, by breaking skills down to small steps so that they're feeling successful and able to meet the expectations that we're setting. And we use a lot of, depending if a child needs a lot of repetition and multiple times to practice learning a new skill, if they need prompting or supports to be able to display that skill, and a high amount of reward, because we're asking our clients to do a lot of really hard work and things that don't come as naturally to them and that are very effortful. And so it's really important that we keep learning positive and keep our kiddos motivated and engaged in treatment. We want learning to be fun and something that they over time become more intrinsically motivated to participate in. ABA is a science and field of treatment that can be used across all different human behaviors. So it's not just for autism, but it's most commonly associated with autism because there's quite a bit of research showing the effectiveness of ABA to help with specific behavioral challenges that individuals with autism face. So in particular for autism, in general, some behaviors that we might be trying to increase for a client would be communication skills, social interaction skills. We call learning to learn skills, of helping them learn the things that they'll need to be able to learn more naturally from the school setting and the home setting and in their community. And any self-help skills that are going to help with their independence and health and dignity and safety. If there are any risky or dangerous behaviors, then we also have plans in place to help reduce those. And then whenever there is a plan to reduce a behavior, let's say an aggressive behavior, again, because all behavior happens for a reason, we're trying to figure out, well, what's the function of that behavior? What's the purpose that it's serving for that child? And then how do we help teach replacement behaviors so that child has another appropriate, safe way to access whatever needs they're getting met right now with some risky behavior. So that's kind of how ABA in particular is helpful for individuals on the autism spectrum. As we have decades of research to show that it's helpful and effective in those specific areas. And ABA is also really recommended as the treatment of choice by pretty much every major medical association interested in health and well-being of children. I couldn't fit them all in the slide. I put like the biggest names on there, but pretty much there's decades and decades of research really showing that this is helpful and effective. So this really is the treatment that we want, especially young children with autism, to be able to access so that they can really have the most independence in school and later in life. So moving on to our advocacy efforts. So why is advocacy needed? As we mentioned earlier, there's really been growing wait lists for ABA treatment for children with autism. From surveys that WAPA's conducted back in 2017, we were aware of about 800 children who had a diagnosis of autism, were seeking treatment and were not able to access treatment and on wait lists. That increased to 1,200 children about a year and a half later. And then just last year in August, in the middle of the pandemic, but I think it showed things were pretty stable and steady, that at that point we were over 1,300 children that were seeking treatment and not able to access it. I know that's on top of, I know the work that you're doing is really trying to help increase access to diagnostics, which is a whole nother kettle of fish and another challenge. And so we all know that there's many children that are on wait lists for diagnostics or falling through the cracks on that end. And so as that gets shaped up and we get more access, that's going to put even more pressure on the treatment system that can't keep up right now with the number of children that are identified. From our survey data in August of 2020, we found that there were about 3,000 children in Wisconsin who were getting ABA treatment for autism, but that most of those children, over half, had commercial insurance. And I don't have the statistics on what percent of children in Wisconsin have commercial insurance versus Medicaid, but it is my understanding that the majority of children in Wisconsin would have Medicaid funding. And so this tells us that a lot of those kids aren't accessing services. About a quarter of providers are not taking Medicaid at all. And about nearly half of providers have wait lists of at least 6 months or longer for clients with Medicaid. And so knowing the importance of earlier intervention, even if they have families doing everything right and they're getting their child in for a diagnosis at 2, or they're on a wait list for that, they might be waiting up to a year for that diagnosis. Now they might be waiting another 6 to 9 to 12 months to start treatment. And so really valuable time is being lost while kids are sitting on wait lists. And then even once kids actually get into treatment, staffing is a significant issue. That's kind of always been an issue in our field, and in particular right now with every area of the economy not having enough work supply and the worker shortage across the state, it's been particularly difficult in the midst of COVID and with everything going on right now. So even once kids are into treatment, on average, at least 15% of their weekly treatment hours are unstaffed. And so that's a big reason of why there's the wait list, is the providers are trying to do this balancing dance of serving the clients who we currently have and being sure they're getting adequate evidence-based treatment. and then trying to take on new children, and we can only take on so many more new children without providing them less than standard treatment for our current clients. So that staffing continues to really be where that bottleneck issue is coming up. And so in particular, as you mentioned, that everyone I know is having staffing issues right now in every field across the state, but this is a longstanding issue in this field in particular because of the challenge of the work. And what we're able to offer as far as wages to be able to have people interested in starting in the field and then staying in the field. And so for a snapshot of what that looks like, I know there's a lot on the screen, but if you just look at the red line is Wisconsin. So right now, this is the reimbursement rates for Medicaid for all of the states that have Medicaid funding across the country, which it's like 48 or 49. Nearly everybody's got that in place at this point. We beat Illinois. They're not on here. They're one of the states that have not implemented their protocol yet, their benefit yet. So nationally, the mean rate for that basic service, the entry-level service that's being provided is just under $50, the median at $48.76, and we're over here at $38.12, which makes it really difficult for us to provide competitive wages for people to be involved in providing and delivering this treatment. And while it's uncomfortable talking about numbers, and that's certainly not why I'm doing this work or why any of us are involved, it's the reality that if we can't pay staff, we can't keep them, and then we can't deliver effective treatment. And it was actually even worse. I'll explain in a minute. Previously, we were all the way down here, second to last at $28 not too long ago. So we're making meaningful improvements, but this is definitely a significant barrier to us being able to provide effective treatment to children. So the efforts that WAPA has been taking to help address this issue is that we've been, since we were formed in 2017, began working with Governor Walker's administration. And at that point, we were able to get a rate increase for that code. So from 28 to 38, which was a very significant percentage-wise increase. But as you can see, we're still definitely in the bottom half of that graph back in 2018. And then continued to work then when the administration changed to Governor Evers and worked with his office and the Joint Finance Committee in 2019, working on the 2019-21 budget by meeting with members of the Joint Finance Committee, as well as Governor Evers' office. At that point, we really raised awareness and understanding of the need for early intervention and the access challenges that families are facing. But unfortunately, we were not successful in accessing more funding at that point. So we kind of made it to the final four, but not all the way. The health committee on the within Joint Finance was looking at 19 items to include in the budget, and we were one of the 19 that was being discussed, but only 4 items actually made it into the budget. So we made it, we were close, but didn't quite make it. And then, so we were encouraged by the Joint Finance Committee members to try and do what's called a legislative council study, and the next year to really help continue to raise awareness to really understand the problems that families and communities are facing, and then try and develop some problem-solving strategies around that. COVID happened, so then we weren't sure where that was going to go, and we were then exceptionally grateful that a kind of virtual format was put in place, and we were included as one of the very few topics that were able to be studied by the Legislative Council in 2020. And so then there was a 4-part series in September of last year on early access to autism services. And the Weissman Center participated in that as well. They kicked it off on the first week. WAPA was able to present some of our findings the second week, and then there was additional information for 4 weeks. So now that's documented within the Legislative Council that they have these resources they can go back to learn about autism and ABA treatment and access issues and some potential solutions that were proposed. So that was really helpful in raising awareness and getting more people interested in helping support this cause. And then we were able to identify our champion in the legislature with Senator Andre Jacques, who's really been trying to then push forward more funding and more support for services for autism. And so with those continued efforts, we were very excited in January of last year to be then included in Governor Evers' budget proposal with a significant 25% rate increase for all of, there's actually 5 codes that we use for our treatment services. which was a big success and victory and very exciting. But as people may or may not know, the way the budget process works, that's the proposal and not the final budget. So then it was, okay, how do we stay in the budget? We're in the budget, how do we stay in there? Especially with having right now a divided legislature and governor's administration from different political parties. So we continued to then work with the Joint Finance Committee and with the support of Senator Andre Jacques to really try and do our best to keep that in the final budget. The way the budget process works is that the governor makes his proposal that then goes over to the Joint Finance Committee, which is a committee made up of members of both the Senate and the Assembly with representatives from both parties who work together to then try and determine what's going to be their budget that then they will take to both houses and get approved by both houses. And then once that's been approved by both houses, then that goes back to the governor, who does have the object to do line item vetoes before officially signing off on the budget. So these were kind of all the steps that we were trying to work through in the budget process. And so in supporting of that, again, so Senator Jacques was really helpful in trying to advocate for continuing to get that 25% rate increase, which would really put us kind of right in the middle nationally of where rates are. We continued to meet then with members of the new Joint Finance Committee for 2021 to raise awareness and understanding of the need for this support for individuals with autism, and also did a lot of outreach to the community to help get kind of grassroots efforts of individuals reaching out to their representatives to explain how important this was. And that was exceptionally important because it was a bit of a roller coaster ride during that process. There were times when we heard, okay, yep, it's going to be one of these three options. So we're thinking at least there's going to be some support provided. Then a few days later was, nope, anyone that got an increase in the last few years is out. That's just a blanket decision they're making. So there's no chance. Then we had a big call to action and we're emailing everyone desperately, please let your representatives know how important this is, please, please, please. And it was successful. And I get chills talking about it because it's just like, that's the power of us when we get together as a community and that we really can make a difference. As I was watching live the Joint Finance Committee debates and discussions, literally the person in charge of the healthcare section of the budget said, we heard loud and clear the need for more funding and more support for autism services. So it made a difference. So thank you to everyone who contacted their representative. It made a difference. And so in the end, the final budget that was approved did have a 15% increase on one code, which is the code that we use most often. So it's very much appreciated increase that I think is really going to help reward the providers who are already taking Medicaid to be able to then provide better wages to our staff and help support to try and get more children off of that wait list. And at the same time, there's still more support needed, it's still kind of short of what we were looking for. And I'm not sure if that's going to be enough to really kind of entice the other providers who aren't working with Medicaid yet to start taking on Medicaid clients and really help address those waitlist issues. So with that, we're very excited and celebrating the success that we've had. And I'm learning in this process, it's an ongoing journey that continues. And so we're continuing to now work with the governor's office and also with members of the legislature to help find additional solutions to try and address the treatment access challenges that we're seeing for families seeking ABA services for autism. So it's a lot of effort and we're getting that intermittent reinforcement. We're getting some success along the way and there's still more to do. So we'll be continuing those efforts. And so that's where we are right now. So thank you everyone for your attention and for letting us share a little bit about the great work that we're doing at WAPA. My email address is here. It's just my name, rebecca.thompson@wiautism.com. And so with any questions, feel free to reach out and would love to answer any questions and tell you more about the work that we do. So I'll pull down the slide so I can see you all.
I have a question, Becky. Thank you for your presentation. It's so great to learn about your advocacy efforts and the success that you have been having. I was just curious too, is the membership of WAPA open to other providers like speech language pathologists or OTs, or is it primarily an organization intended for ABA therapists?
That's a great question. So right now it's been focused on ABA therapists, really just as kind of how it organically evolved, because of the previous funding system through the Children's Long-Term Support Waiver was providing those services, which required that behavior analyst or psychologist overseeing services. And then as it transitioned over to the Medicaid benefit, that was really kind of how we all got together for looking at those particular challenges in providing behavioral services. But we're certainly very interested in collaborating with other service providers as well. We know that it's not the only service needed for children with autism. So we've been advocating in particular for behavioral treatment, but are very interested in working with any other providers as well.
Thank you.
Thank you.
And then Becky, I don't know if you saw in the chat, but Meredith commented, great to hear details. Oops. Great to hear details and inner workings of your group. As someone who helps families access evaluations and treatment for ASC, this advocacy directly impacts my work.
So thank you very much. I appreciate it. And I've seen both sides. Being a clinical psychologist, I do the evaluations as well as a behavior analyst overseeing treatment. So I kind of have a foot on both sides. And as important as it is to give that diagnosis, it's gut wrenching to say, yep, here's the issue and I know how to help and I can't offer that help right now. And so really trying to help increase access to that support that families are looking for.
Any other questions?
Yes. Do you have the list of the providers in Dane County to accept Medicaid for this therapy?
Who in Medicaid does? I wouldn't know off the top of my head. Usually you can get that with the local autism society. So the Autism Society of South Central Wisconsin. Yep, that would be Dane County, South Central Wisconsin. In their resource guide, they'll probably have that information. I know the Milwaukee area one, it does list all the providers and specifically whether or not they take Medicaid. I am aware that there's more providers in Dane County who are actually going to be exiting from taking Medicaid in the new year as well. So I know it's going to get more difficult in the area.
Is that simply because the reimbursement rates are so low?
Largely, there's also a lot of administrative, I mean, as always with Medicaid, there's a significant level of red tape. And which is there for a reason. It's there to be sure that there isn't Medicaid fraud. Unfortunately, in other states and in Florida, there's been significant clear Medicaid fraud and some other states as well with ABA services. So there's a reason to be cautious to be sure that people are not misusing the system and the funds that are available. But it's significantly more work. It's 3 to 4 times more work to be able to secure authorization through Medicaid than through commercial insurance. There's higher qualifications for providers. So clinicians actually have to have more experience and higher credentials. So there's a lot of administrative issues as well. And so when you put together significantly lower rates and significantly increased administrative costs, that it makes it difficult to for companies to keep their doors open taking Medicaid.
Hi, I have a question about how telehealth has impacted ABA services. I know once upon a time, Wisconsin had very restrictive telehealth laws, but it's my understanding that that's opened up to even include, supervision being able to happen. Can you talk a little bit about the telehealth changes and how it's impacted your work?
Yeah, absolutely. So again, we sincerely, as much as I might sound like I'm complaining about Medicaid, I don't mean to be. DHS has been incredibly collaborative with the treatment providers. And so throughout the pandemic, we had regular meetings and providing information about what's available through telehealth. That opened up pretty quickly in April of 2020, where with the governor's order that went in place, literally every Medicaid covered service could be provided via telehealth. And so that actually included all levels of our service of direct patient care, supervision, and family training. In general, I think providers are finding it most effective to do parent training and provide supervision over telehealth, depending on the client, especially with very young children. It can be difficult to do that direct intervention over telehealth, but there are some children that can benefit from that service. So it's really trying to determine individually what's clinically appropriate, but that can be a helpful way to provide that continuity of care, especially because a lot of our services are in home. So it could be that a family member has COVID or COVID exposure, but our client doesn't. And so that's helped with continuity. And I know that in the new year, we'll be switching over to then the permanent telehealth policy. And from all the information we have so far from DHS, it's going to look exactly like the current policy, which we're really appreciative of, that we kind of all learned quickly how much we can do with telehealth. That was kind of as much of a exciting adventure as that was spring of last year. It pushed everybody to get creative, and we learned a lot really quickly. And even thinking about, hopefully when COVID is behind us, telehealth could be a great solution for Wisconsin weather, when we have a big snowstorm and we can't get to clients' houses, or again, if someone else in the home is ill and we can't go in to see them, but our client is healthy. So I mean, there's going to be a lot more telehealth access permanently through Medicaid, which we're really excited about. And reaching more rural families as well. It's definitely more helpful. I can see a family a lot more often who's further away, where I would have had to see them less often because of what that drive would have been before. So something positive out of the pandemic.